Hello people, in this video let's look at cyanosis. Cyanosis is the bluish discoloration of the skin and the mucous membrane or the mucous membrane. Why? Because more of reduced hemoglobin. Now this is very difficult to understand, right? The partial pressure of oxygen is less than 85% and partial pressure of oxygen is less than 85%. Okay. Due to the presence of abnormal hemoglobin pigments in the blood, abnormal hemoglobin pigment. Okay. There are two types of cyanosis, ion replete and ion deplete. So you have two types of cyanosis, ion replete and ion deplete. What is this ion replete? Compensated erythrocytosis. That means it is trying to make more blood as a compensation. Now what is ion deplete? The name itself says that there is less iron, is it? Decompensated erythrocytosis fails to establish the equilibrium. So there will be hyperviscosity, etc. We'll just remember as ion replete, ion deplete. Ion deplete means it is not able to compensate. Okay, deplete, obviously no iron, something like that. Ion deplete. Okay, fails to establish the equilibrium. This is what we will remember. Okay, then this is one type of classification of cyanosis. There's one more called peripheral central differential. Okay, this is the other classification. So this one, what they are showing you for this baby here, the first one, they're showing peripheral cyanosis. Only the hand is blue, right? And in the second one, the mouth, the tongue is blue. And also actually the head. But anyways, remember mouth, tongue, this is central cyanosis. And why does peripheral happen? As anybody on earth, you will be able to guess why peripheral cyanosis happens, right? Why do you think a peripheral cyanosis will happen? Because of cold exposure, as simple as a cold exposure, or an arterial obstruction, or a venous obstruction. So blood flow is not happening correctly there. Redistribution of blood flow from extremities. Redistribution of blood flow from extremities. And then they are saying that there is a reduced cardiac output, but this sounds more like a central thing to me. Okay, anyways, this is peripheral cyanosis. Now, why does central cyanosis occur? Central cyanosis occurs because of two things. You have to mention these two. Oxygen saturation is less. Okay. Decreased oxygen saturation or hemoglobin abnormality. These are the two main headings you have to remember. Okay. So when will arterial oxygen saturation be less? When you are at a high altitude, there is less atmospheric pressure. So you can have cyanosis, central cyanosis. Impaired pulmonary function. Your lung itself is not able to pull out the oxygen. So though the air is fine, your lung is not fine. Alveolar hypoventilation. So the blood, there is not enough air, hypoventilation of the alveoli. Ventilation perfusion mismatch. Now they are talking about the alveoli and the blood, the mismatch. So you understood, right? They are going like this. This is your lungs, trachea bifurcation, and this is your lung. Okay. So that is how they are coming from. First of all, oxygen is less in the air. Decreased atmospheric pressure. There is lung function is not proper. Okay. Or the alveoli are not getting enough air. Hypoventilation. Or next, the blood supply to this alveoli. There is mismatch between the ventilation and the perfusion. Or there is some problem. Blood is also there. Air is also there. The diffusion of the oxygen is not happening correctly. Till here you have understood, right? Come here to this one. Look at this one. Anatomic shunts are there. That means cyanotic congenital heart disease. What do you mean by cyanotic? Cyanotic means the deoxygenated blood. Okay, see where is the deoxygenated blood? Deoxygenated blood is here, right? And oxygenated blood is here. The deoxygenated blood is coming to the oxygenated side. So this left ventricle will push out into the system. It is pushing out the deoxygenated blood. So deoxygenated blood is coming to your systemic circulation. What do you call? Yeah. So basically cyanotic congenital heart disease. Okay. Normally the cyanotic is bad, right? Acyanotic means what will happen? Acyanotic means the oxygenated blood can be going to the deoxygenated side, which is fine, which will anyways land up getting oxygenated again. But cyanotic means the deoxygenated blood will pour into your body, right? Pulmonary arteriovenous fistula means what? There is some in the lung, pulmonary arteriovenous fistula. That means there is some abnormal connection between the artery and the vein. So what will happen again? Venous blood is coming to the artery. So some cyanosis. Okay, that's what you can remember as. Multiple small intrapulmonary shunts. Again, same thing. Some within the lung, some shunts are there. Okay. Then hemoglobin with low oxygen affinity like HbK. So they are not having proper hemoglobin, which they have put here in oxygen saturation anyways. There is a hemoglobin which has low affinity to oxygen. See, you know that there are many types of hemoglobin, and there is adult hemoglobin, and then there's fetal hemoglobin. This fetal hemoglobin has a lot of capacity to suck out the oxygen from the mother's hemoglobin. So some hemoglobin are very powerful, and unfortunately in some people, if the hemoglobin has low affinity to oxygen, they can have central cyanosis. Okay. Now let us go to hemoglobin abnormality. The correct person would have put this statement here, because this is a hemoglobin abnormality. Right? We'll put it. Okay. Methymoglobinemia. Now, methymoglobinemia means what? This is yet another type of hemoglobin which won't be able to do its job. We have a complete video on methymoglobinemia. Wait, let's see. See, normal hemoglobin will have ferrous, but methemoglobin will have ferric. So it cannot deliver oxygen well. That is the thing. It can probably carry, but it cannot deliver it to the tissues. Okay, that is what the problem is with methymoglobinemia. So this one won't be able to deliver the oxygen. Ferric ion will be there and can't deliver oxygen. Okay, to the tissues. So this can happen because of hereditary reasons or acquired because they took some nitrates, nitrites, sulfonamides. Okay, just check. So if a person is having central cyanosis, could be that he has taken nitrates, nitrites, sulfonamides. Okay. Sulfhemoglobinemia, one more type of hemoglobin which is not able to carry oxygen. Carboxy hemoglobinemia is actually carbon monoxide, right? Carboxy hemoglobinemia is carbon monoxide. Remember, if carbon monoxide is there, then it will not give opportunity to anybody. It will bind very strongly carbon monoxide. So this one is going to be COHB. Okay, carbon monoxide, remember. Carbon dioxide means it will be called as carbaminohemoglobin, right? Carbaminohemoglobin is not a problem. Carboxy hemoglobin is a problem. Okay. Then they are telling how will you know that a person has methemoglobin? You just take his blood and you expose it to the air. If it is cyanosis, then it will turn bright red. Okay, that's what you can remember, bright red. Okay. Now let us look at how to know what is the difference between central cyanosis and peripheral cyanosis. You should write this in the exam. Remember, you should know the difference. Peripheral cyanosis means there is peripheral stasis, right? Nail bed, nose tip, earlobe, extremities. Basically, extremities will be blue, right? So let's see this. And cold weather, etc. And if you warm the extremities, the cyanosis can go. And even if the person takes oxygen, there can be no change because it is an extremity. And arterial blood gas will be, even it can be 85-100%, it can be 100% also. But because of cold weather, he might have peripheral cyanosis. Okay. Now coming to central cyanosis. So where and all will you see central cyanosis? Whole body you will see. And even if it is warm, you will see. And when you warm the person, he will not lose the cyanosis, that is central cyanosis. If you give oxygen, he may slightly improve. And in these people, the oxygen is less than 85% oxygen saturation. So basically, people can have cyanotic heart disease, right to left shunt, right? They can have some lung disorders, which is not able to pick up oxygen from the atmosphere, right? They can also have clubbing and polycythemia. Polycythemia you will see in high altitude people, right? Now, there was just one more term, differential cyanosis. So what do you mean by differential cyanosis? Differential means only in lower limb. okay? So, or only in upper limb. So, or it can be only lower limbs plus left upper limb. Wow. Or lower limbs plus left upper limb. So, what do you think? Left means something to do with the heart? So, all this is happening in patent ductus arteriosus, okay? So, you have that shunt in fetus, right, for fetal circulation. Probably that is still open. So, that patent ductus arteriosus. So, these people can have this differential cyanosis, okay? So, these people can have right to left shunt. So, where there is deoxygenated blood entering the oxygenated blood. See here, there is patent ductus arteriosus, so between the aorta and the pulmonary vein, isn't it? But usually they are showing that from aorta it is entering the pulmonary vein. So, oxygenated is entering deoxygenated. This is still fine. But when it is going the other way, whenever there is a right to left shunt, that is when you will see cyanosis. Okay, so it is not just PDA. It is PDA with pulmonary hypertension. So that will cause a right to left shunt. Okay, so PDA with pulmonary hypertension. So the pressure in the pulmonary side is more, which will lead to, this will lead to a right to left shunt. That means a right heart to left heart kind of a shunt. That is deoxygenated blood to oxygenated side. This is when the cyanosis will happen. Okay, remember, it is not PDA which is causing the problem. It is PDA with pulmonary hypertension which is having the right to left shunt, which is the problem. Okay. So this PDA with pulmonary hypertension is for this one. And this one is PDA plus pulmonary hypertension plus right to left shunt plus transposition of great vessels. Transposition of great vessels. That time upper limb is affected. This is just becoming too much, right? And in addition to the lower limbs, if left upper limb also is cyanosed, then the patient has patent ductus opens proximal to the origin of the left subclavian artery. So when does this happen? This happens when patent ductus opens proximal to the origin of the left subclavian artery. Okay. So basically, did you understand the statement? The patent ductus opens proximal, that is near to the origin of the left subclavian artery. So the left upper limb is affected. So left subclavian artery will be where? This is the aorta. From aorta only all these branches you will get. Left subclavian artery they are talking about. So there is a artery here and this defect is very close to that artery. Okay, so what will happen? The pulmonary hypertension, etc. will cause the deoxygenated blood to go to the left upper limb, looks like. Okay, so the left upper limb will be cyanosed. So did you understand differential cyanosis? Now last one terminology is there in the textbook called as intermittent cyanosis. This you will see in Ebstein's anomaly. What is Ebstein's anomaly? In this, the tricuspid valve is not proper. Okay, tricuspid valve is not proper. Where is the tricuspid valve? Tricuspid valve. So basically, the tricuspid valve is there in the right side of your heart, right? So this is the tricuspid valve normal. Here you can see the valve has issue. It's in the wrong position actually, they are saying. The valve flaps are malformed. The valve doesn't work. So blood will leak back through the wall. So you can see the right atrium is so huge. Because this valve is not doing anything. This ventricle will be a little high pressure. So when it squeezes, this valve is not proper. Everything is going back and the atria is suffering a lot. So what will you see in these people? Intermittent cyanosis. Here and there that will have cyanosis, looks like. Not all the time. So in this video you covered cyanosis. You looked at what iron deplete cyanosis is. You looked at what peripheral, central, differential, intermittent cyanosis, right? All this you looked at in this video. Okay. Bye bye.